Sweet Paws is massage therapy. It's a massage therapy local business, and I got into it, it's a little bit like we were talking about before about the integrated whole health model. So when I say massage therapy, it's a little bit different from kind of what you would think of. Hopefully there is a movement towards thinking of massage therapy as more of a little bit more of a healthcare model, and thinking in terms of just like going to a physical therapist or going to your doctor for pain management. Massage therapy can be thought of as such. So kind of gearing away from the term like masseuse, for example, using language that incorporates the term therapeutic massage or massage therapy. Masseuse is a little bit of an outdated term that's kind of sort of refers more to, like, I guess, a spa atmosphere, I would say, or something like that, although you can get very good massages at spas, especially now. Things are starting to get a little bit more integrated in terms of massage therapy as a whole. But just in terms of using that type of language. But I'm interested in healthcare and a holistic approach to that healthcare, so integrated, complementary medicine, as some would call it, and sort of those terms are used interchangeably. But as a massage therapist, I like to know each individual's whole health history. So filling out an intake form is a really big part of me getting to know you as my client, making sure I know if you're living with any kind of chronic illnesses I should know about, like high blood pressure or diabetes, things like that, taking any medications, because I like to approach someone's whole health, like I keep saying, and just making sure that I can kind of help with the whole wellness of that person. So a lot of people come in, to help manage their pain, for example. Some folks come in, with sleep problems, for example, or migraine headaches, chronic migraine headaches. So things like that are important for me to know about so that I can help kind of with that treatment plan of what I would do as a massage therapist and what work I would do with you. There's a bunch of different types of modalities of massage therapy out there, and we'll talk a little bit about those, like sports massage and Swedish and deep tissue. So you're going to hear a lot of terms like that. And at any given place where they provide massage, especially in a place like DC, you're going to have lots of great places that offer massage. You'll see Thai massage, you'll see deep tissue, things like that. I think in terms of in a broader general sense, I will talk about the difference between using a term like massage therapist or therapeutic massage or clinical massage therapist as opposed to masseuse, is just to make sure to really differentiate between somebody who's very well trained in physiology, anatomy, certain pathologies that are be a part of different diagnoses. That's a therapist. That's a massage therapist, somebody who's really well-versed and who went to school for this, who's licensed, and who approaches their work from a clinical standpoint, but also, of course, from that standpoint of your what you would think of as getting a massage, relaxation for rest, relaxation, rejuvenation. Yes, there's that sense of going and having that meditative experience, even reaching that Zen state. All of that refers to a nervous system response of relaxation. So you have that sense of that spa mentality, or sort of that spa sense, of course, definitely, because when health and wellness is part of the picture, then by all means throw it in there. But just using a little bit of a different, there's misnomers with masseuse that can often go into blurred lines, blurred areas that we really want to stay away from, very unprofessional, taboo sort of gray areas. So that's where we really want to make sure to differentiate that this is a respected profession and we take it very seriously. So I think that's kind of more of what I'm talking about in a general sense. But you, as somebody, a consumer of massage therapy, especially in a place like DC, New York, anywhere really, you're going to find a wide array of different types of modalities that are offered out there that you just kind of have to find your right niche. Some folks really like deep tissue and some just kind of really want to be in more of that relaxation, meditative experience. And some want both. So, you just, like doctors and psychotherapists and anything else out there, you kind of have to find your, what you collaborate with, best and what works best for you. Posture is so important these days, and people are starting to get into, the movement towards like things like standing desks and getting up and walking at, intervals throughout the day and making sure to kind of keep joints limber and moving. And yeah, especially working at a desk and, hunching forward and towards all the electronics that we use, like computers and phones. We are very much kind of moving towards like hunching over, upper back, shoulders, neck. We carry a lot on our upper back and shoulders and neck. So yeah, I hear that a lot actually as a massage therapist. Folks coming in for definitely sort of, I would say, a universal place of pain and a source of stress and tension can be, your shoulders, your neck, upper back, things like that. So I hear that a lot, and I do a lot of work to help relieve that kind of stress and tension that's all pent up in there, as well as just sort of the chronic pain that involves that as well. Great question, because again, where there's a movement towards moving away from that sense of it as a luxury, as I got a massage and the next time I'll get one is 2018. It's to make sure to kind of incorporate it into almost not an everyday, but your lifestyle, just like going to a doctor, going to physical therapy, going to get your teeth cleaned, regular health maintenance. So often you'll find people who come in once a week for a massage or once a month for a massage. I have a client who has a lower back slip disc, and she's got a lot of pain. She's been dealing with it for years, and she comes in to me weekly. For a time there, she was coming in to me twice a week. So there's a pain management aspect that I was working on with her in terms of our treatment plan together. And now she's back down to, once every 2 weeks. So it can change. It can vary based on the person and the time, the timing. Also, I have a client who's a prenatal client. She's in her second trimester of her pregnancy, and she's getting once a month massages. So her choice is to do it, monthly. So there are, contraindications, as it were, so to speak, times when you shouldn't receive massage. Those contraindications include things like if you're feeling like you're coming down with a cold, that can indicate that your body's kind of inflamed, fighting off maybe a fever. That would be a time when maybe staying away from massage, as it sort of increases a lot of circulation and vasculature and blood flow. That could increase the chances of that cold coming on, a lot sooner. But then other things like going back to me making sure I know the person and their health and what medications they're on, things like that, because certain medications can cause swelling in the lower limbs or, blood clot, history of blood clot, things like that I would want to know about. So I can approach their massage, in the most safe manner, as well as, productive and effective for them and them feeling like they're getting the most out of the massage. So those are the contraindications. That would be what we would talk about, and I could steer someone in the right direction regarding that. And then in terms of frequency, we talked about that. And I think there's always benefits to receiving massage. So I don't think if someone's a well person and coming in once a week, that's totally recommended. There's no contraindications when somebody is fully well. I don't think there's any, time when I'd say, it's time you not get a massage. That rarely happens. By all means, come in once a week, come in twice a week, especially if you're doing well and you want to maintain that. And in terms of how long, the most, I think the body, there's some stimulation and some nervous system activity that goes on when you receive a massage. You attain that sort of sense of great relaxation, and your body kind of relaxes into that state of balance. So I'd say between an hour and an hour and a half. So you'll see 60-minute massages and 90-minute massages. And either one of those is recommended. It's not, there's no real difference between someone who gets a 60 as opposed to a 90. In fact, I would say 90 is the best because I can really focus on an area that you may need focus on, a specific injury or something along those lines. But then I can also do the full body. So a full body experience is a wonderful, way to gain that balance, gain that sense of, homeostasis, which is the body's balance, natural state of balance. So full body massage is what people really like, and they also like to get, maybe if they have a shoulder injury, for example, real focus on that. That a 90-minute can kind of cover all of that. So deep tissue is one of the most widely known. You'll hear that in Swedish, and those are used, often in tandem. So we'll talk about Swedish in a minute, but they're often used together with that modality. So deep tissue refers to exactly what you hear. So you're going into the deeper layers of your muscle tissue, for example. So if we take your upper back, in between your shoulder blades, places like that, lots of muscles in there, lots of muscle structure. So the layer that is right next to the spine is real deep in there, and then there's layers of muscle on top of that. And each muscle has a different function and a different structure and different attachments, and meaning the bones that they attach to and the bones that they move. So when you're doing deep tissue, it's using a lot of different types of tools, tools meaning the type of massage therapist's tools that they're using. So their elbow, their forearm, their fingertips, thumbs, things like that, to really get deep into those deeper layers. And often the massage therapist is working real hard. It's pushing with their forearm and their elbow and really using a lot of their body weight to get really deep and feel deep down in there and to get some of that congestion out. And congestion just refers to what we would hear as knots, I've got these knots in my neck. Knots are kind of those exactly what you would think, knotted up kind of tissue congestion in there. And a lot of deep tissue strokes and work can dissipate some of that congestion and really work that stuff out and work the fibers of the muscle in the direction that the muscle goes, as opposed to the opposite, which is kind of what knots are. They sort of get clumped together, and massage can often even those muscle fibers and that tissue out. So it's a lot about using strokes that increase circulation and movement and vasculature, as I said before, which is blood flow and circulation, and then also using tools, deep tissue tools, to get deeper into those muscle structures. And to answer your question further, anyone can benefit from that. The most important thing to do is check in with your client. Make sure, no pain. We don't want any pain. The misnomer out there when we think about deep tissue is a lot of folks come in, they're like, just beat me up. Just take a drill to my back and just go to town. And I get that. Listen, I feel you. Take a drill in between my, shoulder blades any day. I love some deep tissue up there. But in massage therapy, and when we're thinking about making somebody feel good and releasing a lot of that tension, no pain is gain. It's not a no pain, no gain thing. It's no pain is gain. So we don't want any pain. We don't want to elicit that pain response. Because what happens with pain is your body has this nervous system response that's similar to kind of fight or flight. So you're tensed up, you're alert, you're like, oh God, that really hurt. And you don't want your body doing that. You don't want your muscle tissue doing that. So a deep tissue approach that's good, that's professional, when somebody knows what they're doing, is working with somebody and getting into those deeper layers without eliciting that pain response. And if there is pain, it's up to the massage therapist to really work with the client on how to deal with that. So any kind of pain response that's referring or radiating to a different area of the body, we're really checking in. We're really saying, hey, how does that feel? How you doing with that? You good with that? And there is that sense of release. So a release and that kind of like, oh, I'm working with you to feel that tension and that release, that is different than somebody jumping up off the table and being like, oh my God, I can't handle that. So the difference is clear, and, some people can handle a lot, of that deep pressure, and some people don't want, that at all. So before a massage, I will check in and make sure, do you like a deeper pressure or do you like less pressure? I definitely ask. And then, of course, during the massage, I check in and kind of make sure. And, different parts of the body will vary too. I know for me, when I receive massage, I like it like deep tissue up in my shoulder area and my back, but down around my legs, I like less pressure. So that's just it. That's just my body. So even on varying parts of the body, it'll differ for each individual. I've been doing prenatal massage now for about a year. I really enjoy it. I'm so happy that mom can come in and receive, and we can work around her belly. And the most important thing is to make sure that she is past her first trimester. Second trimester and on is when it's safest to work with a massage therapist. So that's just kind of a general rule. I think the rules can be I don't want to say broken, but you can work around those rules in first trimester if we're working on things like just lower limbs, ankles, feet, hands, things like that, and really staying away from moving any kind of, again, we talk about blood flow when we talk about massage. So prenatal clients often have swelling in lower limbs, so we just want to make sure that we're not increasing that swelling down there when we increase blood flow. So those are some of the sort of contraindications like we talk about with prenatal massage. But beyond that, mom is coming in just like any other non-pregnant client with, my lower back hurts or my upper back hurts, or, I was on the treadmill the other day and my calf muscle felt tight, anything along those lines, all of the above. So it's sort of just like any other massage therapy experience, but we position mom in a certain way so that baby is safe and mom is safe. So mom doesn't want to be lying on her back, that the uterus needs to be supported, and we don't want to be pressing on her aorta and things like that. So the best way for mom to lie is on her side. So I would be using pillows. There are great long pillows out there nowadays for people who like to sleep with a long pillow in between their knees and sort of hugging the pillow so that your body is completely supported when it's on its side. So nothing's pulling, no hip joints are being pulled, or knee joints are pulling downwards towards the table. You want to make sure that everything is supported so that mom can completely relax her arm on the pillow and completely relax her top leg on the pillow. So I would give a massage on half her body there, and I can get as deep tissue and as light as just lying on the table flat or on the back. So it's the same thing. I just have to position mom in a certain way. So sometimes we use wedges, and you'll see lots of those things out there for prenatal clients, just in general, just for sitting on the couch watching TV or sleeping at night. Often using sort of props can help her stay comfortable and keep baby safe. And so then what I would do is just have her turn over and lie on her other side and have the pillows propped up, like same. And I would do then the other half of her body that way. So it's just about positioning and making sure, like I said, mom is safe and comfortable and can really enjoy the massage, and also enjoy full body. So often people really like a full body massage, and the way that all massage therapists work is by draping the body. So you have, your everything covered, and if you're working on the leg is exposed. And then if you're working on the back, just the back is exposed. I can do all that same type of draping with mom and prenatal positioning as well. So we have our ways. It's little tricks of the trade of massage therapy. So, yeah, I just recently have had an experience. That's a great question. I'm glad you asked because it was such a great I'm so happy she communicated that with me because she was definitely like in a Zen state, my client, and enjoying, you know, and the music was on, and it was, you know, around the Christmas time, and I actually had done a home visit out to her with my table to her house. So it was just a really lovely sort of Zen moment. And then I remember, I think it was when I had turned her over on her other side, she kind of was like, oh, baby's kicking. Baby really liked that. That was great, you know, and, you know, communicated with me that she felt a little bit of, you know, movement in the belly and some kicking, but it was like a lovely, not like raucous, you know, rocking out kicking, but just kind of what baby does, I guess, when baby is happy. So it was really nice to hear that.
That's very interesting because I've always wondered, you know, if the mother, I know that the mother and the baby are so connected, and whether if the mother likes something, does the baby respond to that same sentiment? So that's pretty cool.
Yeah. I loved, you know, just the fact that, because I would think that happens, but it was an interesting response. You know, often you would maybe even think that it would be the opposite, like baby was kicking a lot and then the massage kind of calmed them down. But for in this particular instance, yeah, the happiness was kind of shining through with a couple kicks here and there, which was really cute. I liked that. There's so many benefits to massage therapy for athletes. Oh my gosh. And varying different types of modalities like we were talking about. So even within the umbrella of sports massage, you're going to be doing different, you know, just like you said, different types of massage for different types of athletes. So I would almost approach somebody in that collision-oriented sport with a little bit more of a gentle approach, making sure, you know, any work around the neck, head area, you're really aware, any previous history of concussions, things like that, really important. And then, of course, you know, getting down to injuries, you know, any previous knee injuries or shoulder injuries, things like basketball, tennis, you're going to have a lot of knee stuff, a lot of shoulder stuff. So, you know, you're going to be finding a lot of different varying things even within one body for, you know, type of sport. So, so it's great to approach athletes, you know, where they are. Just like any client, I like to say, approach any client where they are. So a client coming in could have had a history of this, that, or the other, but where are they now? How are they now? Where in their recovery or not in their recovery are they? So if there's something specific, somebody might be coming in for a strained muscle, so to, you know, your quad muscle, the one on your thigh, the big muscle on the top of your thigh, you know, strains involving that, I can really focus maybe our time together on that, or if there's pain management. Where are they in their recovery process is a really important question too. Are they in the acute stage, like right after the injury, when there's a lot of inflammation and when the body is trying to regenerate cells? That's when that's contraindication for me as a massage therapist. I would want to make sure to have them talk with their doctor and be recovering and in the right recovery stage period for me to be starting working with them. So that would be in the post-acute stage when they're starting to heal and regenerate those cells, and that process has been started already. That's when massage can really help, you know, get that blood flow back in there, get that vasculature moving, get those cells regenerating and formulating and getting strong again. So, you know, there's, like I said, there's also well visits too for athletes coming in. They're doing good. Everything's good. You know, God forbid there's any issues this season, so to speak, and they just want to maintain that. So coming in once a week for a massage. And when we talk about sports massage, it's really just kind of exactly what I just described. So you're catering it to the individual. You're catering it based on what they're bringing to the table. So, you know, so that's one aspect of it. But another piece of sports massage is to approach the structure, the function, and the muscle tissue. So it's maybe a little bit more of a physical therapeutic kind of approach. So you're maybe working the joint a little bit more than you would in a normal massage. you're not doing as much deep tissue work, getting out knots. You're maybe working more on the range of motion, stretching. So there's other types of things that could be involved in the massage when it comes to an athlete. And a lot of athletes' muscle tissue, because they're an athlete, just the nature of their tissue is really actually healthy. So I find that when I work on athletes, it's really lovely to feel healthy tissue, because you know that they're treating their body really well. They're eating right. They're exercising every day. They're hydrated. So even if there is an injury or there is a problem going on, you can really tell the difference between a healthy athlete and their upper back, so to speak, as opposed to somebody who never works out and sits at their desk all day. It's amazing the difference in the fluidity and the sort of malleability of a healthy tissue. And just piggybacking off of, staying hydrated, malleable, fluid tissue, healthy tissue. Yeah, all of that is really, number one, goes down to what you eat. You are what you eat. Nutrition is so key to living a long, healthy, wonderful life, well-balanced, happy life. So nutrition, I like to incorporate that always in a discussion, just in terms of integrated health and wellness, complementary medicine for sure, because I think we're trying to steer away from that sort of Western medicine model of like going to a doctor and getting medicine and, sort of putting a Band-Aid over certain problems and, dealing with chronic issues throughout life and chronic diagnoses and diseases. When in reality, if you go to the doctor and you actually really talk to a medical profession about what you're eating, what a typical day looks like, when you wake up in the morning, you go to sleep at night, I bet you the majority of what you're eating is causing a lot of the stuff that's causing your pain or contributing to whatever diagnoses you're dealing with. For example, diabetes, a great example, high blood pressure, cardiovascular illness. So a lot of these types of things are, we've got to just start actually taking control of our own health and reading labels, for example. When we go to the grocery store, read, what's in that cracker. If it's 2 or 3 ingredients, that's a lot better than an entire paragraph full of stuff we can't understand. So back to basics, really simple kind of changes in behavior can really help a client maybe of mine who's seeking help for neuropathy, for example. That's a diabetic neuropathy. It's a symptom of people with with dealing with chronic issues due to diabetes. So they might have some pain, numbness, tingling in lower limbs. A lot of that discussion, me working with them as a massage therapist, might actually be about nutrition too. And of course, my approach would be very open, very meeting a client where they are, where, just no judgment at all, just kind of like, what's a typical day look like for you? And that education in that encounter can go a really long way with patients, with clients, with people. If you can just make a little impact, a little change, do you like any greens at all? And once you get to down to that one thing that someone might like, oh, you know what? I do like spinach. I can stand spinach. Great. That's awesome. Let's figure out a way for you to incorporate spinach into your diet. So that's on a basic level, an everyday level, your everyman kind of level. But when you're talking about athletes, that's the model, right? That's what you aspire to. You take your fish oil every day and you're doing your exercise and all that. So it's great to have those people out there who are, eating right, exercising. And those are the types of people that are getting massage regularly too, because they need to maintain that sense of health and like I keep saying balance and the body's natural, system of balance, which is called homeostasis. So we're never really at a homeostatic level. We're always just trying to get back to that. So massage, healthy eating, that all of that can contribute to that balance, that sense of balance. I suggest foam rolling a lot. I really like a foam roller. It can help with working with the part of the muscle tissue called fascia. You'll hear that a lot, myofascial work or fascial work. The fascia is the connective tissue that covers the muscles. All of us have a lot of fascia in our bodies, and that is connective tissue that's really hard, kind of like hard tissue that's different than muscle. It covers the muscle, and it can get really dehydrated. It can get really tense. It can get really congested, like I was talking about before. And a foam roller can really help with that because it's a thin layer of connective tissue covering muscle, and when you roll over the foam, it kind of really works that thin layer very well. So I love suggesting foam roller, especially in between sessions. And yeah, doing any kind of maintenance in between getting regular massages is always helpful. And, massage is also often part of a whole other, a bigger treatment plan too. So someone might have physical therapy that they go to, and physical therapy really is more about the structure and the function of, say, a joint. So someone has knee surgery, they're going to a physical therapist to make sure that they can use their knee again. So they can have full range of motion of that knee, they can bear weight on that knee, and that's what the physical therapist is going to be making sure that they're doing. When working in tandem with massage therapists then on the off days, of physical therapy, they're going to be working on blood flow, circulation in that area, pain management, getting out any kind of kinks or congestion, knots, tissue, things like that out. So again, that range of motion and that full structure and function can be up to its full potential. So Swedish is you're right, is the most widely known, name out there. It actually was founded by a Swedish man. Back in the 1800s, he was working with gymnasts at the time. And I think he was more focused on physiotherapy, physical therapy, again, that structure and function. But with gymnasts, he realized that there's so much movement, there's so much bouncing around, a lot of tumbling, and realized that his clients, so to speak, or his gymnasts with whom he was working, really benefited from not just stretching and range of motion kind of movement, but also working the muscles. So hands on the thigh and working that muscle tissue on the thigh and circulation of that muscle and kind of providing massage. And he realized that it really helped. It helped with ability and the function of the muscle. So he kind of coined the phrase Swedish tissue. I think that's just where it came about because he was Swedish, but it refers mostly to moving fluids. So moving fluids in the body. So long, firm strokes up the thigh, for example, towards the heart. So blood flow, vasculature, circulation, and using broad strokes with the whole palm, all of your hands, the surface of your hands on the body, and again, that sense of moving towards the heart. So from the ankle all the way up to the thigh, you're moving fluids, and it's sort of that typical stroke. So I'll be using Swedish strokes all throughout my massage. If somebody wants a deep tissue, I'm not just going to go directly with my elbow into their hip and just be like, you like that? It's not. You have to, massage is a journey, just like anything else. So you have to get somebody in a comfortable state on the table, really relaxed into the table, make sure that the knees are supported if they're lying on their back, their feet are supported if they're lying on their belly, everything is, take a deep breath, you're draped, completely appropriately, making sure, if music is on, there is that sense of that sort of spa, that sense is a wonderful that we don't want to take away from the idea of massage. So you're always going to be having that sense of being very completely relaxed, quiet setting, light music, things like that. And warm towels, if you have any warm towels, maybe even hot stones, anything to contribute to that, the body getting back to that balance, getting to that sort of Zen meditative state, breathing, and so that somebody can be completely open to receive whatever kind of deep tissue or whatever Swedish. So I'll be doing a lot of Swedish strokes and then deep tissue, and it'll be very interchangeable. So for example, I could do a prenatal massage that incorporates sports, deep tissue, and Swedish all in one. So one client could be getting all 4 modalities that we are talking about. So it's the terms are used to just describe, I think, to help people understand massage in general, but they're not necessarily black and white. Like, I can't use one without the other. They're used in collaboration with one another. Of course, when somebody's not pregnant, I'm not going to be doing prenatal. However, the side lying, I might do. So if somebody has a hip issue, it might be really beneficial for them to say their right hip really hurts. It's probably going to be really good for me to maybe have them on their left side with their hip supported with a pillow, and I can really get into the hip at an angle that is comfortable for the client and really productive. So again, there's different positioning that might happen in different modalities. Again, it's sort of an interchangeable thing. But when we talk about Swedish, it is about moving fluids and vasculature, creating circulation, and somebody may come in and say to me, I really don't like deep tissue. I don't like an elbow in my back. Thank you, just Swedish. That totally makes sense to me. That would be an indication to me that, I would know what to do with that person. Keep pressure really light and check in with them a lot about, what they like. Now, I have had someone say that to me before, and then I get them to a really, relaxed state, and they're like, you know what? I actually think maybe you can go a little deeper if you think that's necessary right here, right now. I could go deeper. So a lot of times people just kind of need to take their time, So it depends. It can change throughout, even within a session. So good question, because you will see a lot of stuff out there. There's hot stone massage, there's aromatherapy, there's things that people can use, and for some folks, they're kind of like, I don't need any bells and whistles. Just give me a blanket on the table, and give me a massage. And I do a lot of that. I have a lot of massage clients who literally we just, what it entails is a table and sheets on the table. And like I said, all massage, no matter what modality, no matter what type, no matter what the client is used with draping. So I have a fitted sheet on the table, and then I have a top sheet, and then I have a blanket on top of the top sheet. And, when I'm working on the arm, I expose the arm, and none of the rest of the body is exposed. When I'm working on the left leg, I expose the left leg. So we have our ways of draping. We learn that. It's very technical. I mean, not just kidding, but it is, it does take time. People, even doctors, have a hard time, listening to the heart, for example, out there. So you do learn in a lot of clinical settings how to make sure that somebody is comfortable and they don't feel overexposed or underexposed or, anything like that. So draping is always taken into account, and I make sure that I know what I'm doing with that. And the person is comfortable, because often someone does undress completely. And so that's why it's really great to know your draping and know your techniques, because the best way to get a full body massage is to be completely on, just if you want to keep your underwear on, that's fine. But that's sort of the general message, is to know that someone is safe and approaching the massage in a very appropriate manner. You can feel comfortable to, expose, skin to skin, because that's where you're going to get the best massage possible. I have done massages with people who've been through a lot of different types of life experiences. So I've done massage over, clothes many, many times. So I have a lot of experience with different varying, senses of personal safety and things like that. So that's something we can talk about a little later. But the tools that we use are, like I said, so draping, your blankets. Sometimes people have essential oils. Like a lot of times I actually have lavender in the room. I'll drop a little lavender on the palms of my hand, and I'll have somebody just breathe that in, and it's a lovely, you'll be amazed at what just breathing in lavender the sense that it can give you. The sense of smell in your brain is highly connected to the limbic system. Limbic system being responsible for all of what we've been talking about, just all systems of the body. And when that is stimulated in a relaxing way, it can really help with, again, that nervous system response, getting into balance, back to a Zen state, meditative state. So people use oils. So again, you just want to check in with your client. Are you allergic to anything? Do you have asthma? Do you have anything that gets triggered by certain smells? All of those things would have to be asked before, breaking out any kind of oils. And then hot stones, I have seen that around. Those are often used as a tool. I prefer just to use my hands, my elbow, my forearm. I can feel better that way. When I use a stone, I have a barrier in between my hand and the person's skin. So I don't feel as much, but it's kind of nice. It's a hot stone going, and you can kind of use that doing Swedish strokes often, just using the hot stone to apply the oil up and down the back, for example. It can feel really nice. But when I really start to want to get to work and really get in there to muscle tissue, I'm going to be using my hands and my arms and my forearms. So I think that's it in terms of just like standard stuff you'll see out there. And I have some of that stuff. I don't have hot stones with me, but I work at a place one day a week that has, a little hot box with stones in them. And sometimes I'll just use them to warm up my own hands. If my fingertips are cold, that doesn't feel good on a person. So I'll just use a hot stone to simply warm up my own hand and to make sure my hands are warm. So there's, again, little sort of tricks of the trade out there. There's a movement towards massage therapy or therapeutic massage, like I was saying, and I think you'll find a lot people out there with the right credentials. Often massage therapists these days have other degrees. So I have a master's degree in clinical psychology. I was a clinical psychologist for 10 years, working here in DC. So I learned so much about a person's whole health as a clinical psychologist. I learned that along with any type of mental health issues, depression, anxiety, there are also chronic illnesses going on too at any given moment with any given person. So diabetes, hypertension, HIV, hepatitis. I mean, there's a lot of different chronic illnesses people are dealing with, especially here in DC, you'll find. And then also, going back to nutrition, going back to talking about whole health, integrative, complementary health, eating right, exercising, all of that stuff can go back to your general health and then, of course, your mental health. So it's all related. I like to say I was studying and learning about the mind, and I kind of moved down to the body. But it's all connected, right? Our head and our bodies are connected. So we are working as one holistic system as human beings, and it's important not to compartmentalize mind, body, spirit so much, and get back to that sense of let's get back into our bodies, let's get back into moving, and that sense of general state of wellness and health. And so as somebody who's worked with clients who experience depression, anxiety, post-traumatic stress symptomatology, that very much informs my work as a massage therapist. At any given moment, a client is coming in with a lot of different things going on, whether they be actual diagnoses, diagnosed by a doctor out there or not. They're going to be coming in as a complex person. And so somebody who's dealing with sleep problems, for example, can really benefit from regular massage. That getting to that body back to that balance, that sense of homeostasis, that zen, that meditative state on a table with a massage therapist can really help you get back to healthy living with healthy sleep patterns. So that's just an example. So you want to look for somebody who knows what they're doing, who has, credentials, who has you don't necessarily have to have another degree. But, DC is a place where you're probably going to find people with multiple degrees. It's just that kind of a city. But, making sure that person is licensed, and they really went to school for it. They know, you can really tell when somebody knows what they're doing, because if you say, I have this, I had this surgery for this specific thing, and, your massage therapist doesn't really say much or doesn't really know much about that's sort of an indication, okay, maybe they're not as well versed in healthcare as I'd like them to be. But you know what? You can go out there to a spa and find somebody who's really good, maybe somebody who used to be a nurse, so you never know. It's like, there's different types of people out there who are going to be incorporating what they want to incorporate in their practice. But I think it's important to find a massage therapist who meets the client where they are. So, with a full, open kind of sense of that person. So if that person just recently had surgery for this, that, or the other, or just lost their job, or whatever it might be, the person's, has that sense of working with a massage therapist that cares about them, that isn't just here, one-stop shop, just, okay, get a massage, good luck, see you later, that there might be a little bit more of a process to it. You have to fill out an intake form, talk about any previous history of surgeries or what medications you might be on. So you need to be a little bit willing to go the extra mile, I think, for the most professional massage therapists out there. But generally, any place is going to want you to fill out an intake form with certain information, just to make sure any disclaimers, things out there. But when you see an intake form that also includes, any questions about medical health and medical health history, I think that's a good indication. Okay, this might be a little bit more of a well-rounded, integrated approach, that I want. At the spa, for example, you might have just a half a page, like disclaimer, like, signing your life away, really just to say, I have agreed to receive this massage. So that's the extremes of different intake forms that you'll see out there, and can give you kind of an indication of what you might be getting in the massage. I'm originally from Boston, came down here in 2000, so I'd actually say I'm pretty much a DC native at this point. I think 17 years makes me. So I'm still a Patriots fan, but, go Skins. You guys try every year, come on, more power to you. So I'm a DC lover, definitely deep down, always will be. Definitely my second home, first home, whatever it might be. So it's nice to be here in the city and collaborating with such great people. And there's a sense of small townness that DC, despite it being a pretty big city, sort of semi-big city, there's a town feeling to it. So it's nice to be a part of sort of a small business movement, grassroots movement. DC is a great place for that. Yeah, so sweet paws. So oftentimes when people hear sweet paws, they think, oh, PAWS, like your paws are massaging people, like your paws are paws, or they think, are you an animal massage therapist? So there is definitely a play on words there. I love it. More power to people. Take it, run with it. But it's actually PAUSE, and when people see that, and then of course, it gets even more interesting to folks like, oh, sweet pause, as in like a pause, like, oh, okay, I get it. So yes, I meant to do that. That is totally pun intended. But yeah, you really are taking a pause when you get a massage. It is in whatever capacity in your life. Some people go in their lunch break. Some people go on the weekend. Some people go after work. Some people go before work, first thing in the morning. You're taking that pause. You're doing often almost like a meditative process. You might even think of it as meditation. I know when I receive massage, I really focus on my breath, and I'm really in my body, and I don't like to talk, and, you know, I'm really silent, and I like to enjoy the massage. That's kind of like a meditative state for me. Some people like to talk. Some people like to talk about issues and kind of almost, their massage therapist is like a therapist. So there's different, you're taking a pause, you're taking that time for yourself. It's about your health. It's about your wellness. It's, you know, leaving your kind of baggage at the door, so to speak, and for you, you know, not for anybody else, you know, not because you feel like you have to, but because it's a time for you to pause from all of that. You're not looking at your phone. You're not on the internet. You know, it's a pause. It's a sweet pause, you know, and you're hitting that sweet spot of getting that chance to sort of go offline, so to speak. And then, of course, my background is in psychology, and there's a huge movement with service dogs. I work with a lot of people. I work one day a week at the VA Medical Center, the Veterans Affairs Medical Center, and a lot of folks who are experiencing post-traumatic symptoms often have service dogs. There's therapy dogs, stress therapy dogs, anxiety dogs. There's also diabetes dogs, epilepsy dogs. Service dogs are incredibly interesting when you're talking about the relationship with humans and the brain, and how the brain, actual neurological responses to having an animal there can help you relax and deal with whatever stressors are happening in everyday life. So it's kind of amazing. So psychology really, you know, has opened me up to a lot of different things, you know, all of this. So I encourage, if a client has a dog, whether it be a seeing eye dog or a service dog, therapy dog, whatever it be, I encourage any setting that I go into, I'm totally fine with dogs. I like to make sure to incorporate that knowledge. Like, you know, if I go to your home and you have an animal, that's fine with me. But also coming to my office, I'd want to make sure that my office would be service dog accessible. So that's just sort of an added extra, like, little tiny thing, but it's just funny. I definitely hear a lot of people say, oh, pause, like PAW. And that is just my way of being like, no, but speaking of pause, as in PAWS, you know, that's just sort of an added funny little story to add on to it, and just to make sure that people know. But yes, as it is, it's a sweet pause, and that came from that sense of you are taking a pause, you are taking time out of yourself to contribute to your health and your wellness. I'm just so happy that we've been talking, and it's great to get this type of conversation going when we talk about integrative health and complementary health and medicine. I love collaborate. I love that now I can be collaborating with Doctors to You. I look forward to, in the future, in the coming months, in the spring, summer, possibly having some wellness events, some community events out there. So sometimes you see out there at airports or varying settings, massage chair, people who get into an actual chair and receive a chair massage. That would be something that I would love to do, have my chair massage, and be part of a community wellness day with, say, Doctors to You, or I also have another partner with Eventide Wellness. She's an acupuncturist in town. So partnering with organizations and kind of looking ahead and looking forward to Sweet Pause, working with places like these to do community, you know, wellness event days where maybe there's a doctor's visit with a flu shot, and then maybe a 10-minute chair massage, and then, you know, have a 5-minute, you know, meeting with a nutritionist, talk about healthy eating habits, things like that. So getting this type of conversation and this type of movement happening out there, kind of in the streets, you know, in people's buildings, community buildings, in people's residences and their homes, and making it part of, kind of, like I said, part of a movement. And I really mean that, getting back into our bodies, making sure we know what's going into our bodies. So I look forward to doing things like that. My website is asweetpause.com. And that's where I, would post up things like, oh, this wellness event is happening spring 2017 with Doctors to You at Trader Joe's or something like that. So you'll be seeing things like that posting on my website. And just in the meantime, asweetpause.com is a great place to go to read a little bit about the modalities I was talking about before, and just a little bit more about me and my history, sort of my bio, and then also that's where you can schedule a massage. I have my contact information there, and there's a little application to schedule a massage as well. So that's a little bit just sort of logistically about me, and yeah.